Type 2 diabetes is called a chronic progressive disease. That's the language in the textbooks. That's what your endocrinologist was taught in medical school. Chronic, meaning lifelong. Progressive, meaning it only gets worse. The treatment model follows this assumption. Start with metformin, add a sulfonylurea when metformin isn't enough, add a GLP-1 agonist when 2 drugs aren't enough, start insulin injections when 3 drugs aren't enough, more medications, higher doses, increasing complexity, the disease progresses, the drugs accumulate, the patient deteriorates. This is the standard trajectory of type 2 diabetes in mainstream medicine, and it is wrong. Not wrong in nuance, wrong in premise. Type 2 diabetes is not a chronic, progressive disease in the way you've been told. It is a reversible metabolic condition caused by a reversible metabolic problem, insulin resistance, that responds to interventions that mainstream medicine rarely prescribes because they don't come in a bottle. I've seen patients come off 3 medications. I've seen A1C values drop from 9 to 5.5. I've seen fasting insulin levels normalize, liver fat disappear, blood pressure resolve, and patients walk out of my office on 0 medications with blood work that would make their endocrinologist question the lab results. And not one of those reversals required a new drug. They required removing the cause. Let me be precise about what reversal means and what it doesn't mean, because language matters in medicine, and I refuse to overstate the evidence. Reversal means achieving non-diabetic blood glucose and A1C levels, fasting glucose below 100, A1C below 5.7, without the use of diabetes medications. It means restored insulin sensitivity, measured by fasting insulin below 10 and HOMA-IR below 2.0. It means the metabolic dysfunction that defined the diagnosis is no longer present by any measurable criterion. Reversal does not mean cure. A person who has reversed type 2 diabetes will develop it again if they return to the dietary and lifestyle patterns that caused it. The genetic susceptibility remains. The metabolic memory remains. The tendency toward insulin resistance, if provoked, remains. Reversal means the disease is in remission, sustained remission that can last years, decades, or a lifetime, provided the interventions are maintained. This is not a semantic distinction. It is an important one. You are not cured. You are in control. And as long as you maintain the behaviors that reverse the condition stays reversed. Now let me explain why reversal is possible. Because the biology is clear. Type 2 diabetes is caused by insulin resistance, cells losing their sensitivity to insulin signal. In response, the pancreas produces more insulin, hyperinsulinemia, to force glucose into resistant cells. Over years, the pancreas burns out, insulin production drops, and glucose rises. The standard medical model treats the rising glucose with drugs that either increase insulin production, sulfonylureas, increase insulin sensitivity, metformin, slow glucose absorption, alpha-glucose oxidase inhibitors, or replace insulin directly, injections. None of these treatments address the root cause, the insulin resistance itself. They manage the downstream consequence, glucose, while the upstream driver, resistance, continues unchecked. Some of these treatments make the resistance worse. Sulfonylureas whip the already exhausted pancreas into producing more insulin. Insulin injections flood the body with the hormone that cells are already resistant to. Both approaches are like treating a noise complaint by turning up the music. They address the symptom while amplifying the cause. Reversal works by addressing the root cause. There are 2 primary interventions, dietary change and fasting, and both work through the same mechanism, reducing insulin demand. When insulin demand drops, cells are no longer bathed in excessive insulin. Insulin receptors begin to resensitize, they upregulate. The lock becomes responsive to the key again. The pancreas can produce less insulin and still achieve glucose clearance. The cycle of escalating resistance and escalating compensation reverses. Sensitivity increases. Insulin drops. Glucose normalizes. The disease process that has been building for 10 to 15 years begins to unwind. The dietary intervention is straightforward. Eliminate the foods that produce the highest insulin demand. Processed carbohydrates, white bread, white rice, pasta, cereal, crackers, chips, produce rapid glucose spikes that demand large insulin responses. Sugars, sucrose, high fructose corn syrup, fruit juices, produce both glucose and fructose loads that drive insulin secretion and hepatic lipogenesis simultaneously. Seed oils, through their inflammatory effects and their impact on cell membrane composition, contribute to receptor dysfunction. The prescription: eat real, unprocessed food. Vegetables at every meal, quality protein, eggs, fish, poultry, meat, healthy fats, olive oil, avocados, nuts, coconut oil, butter. Eliminate processed carbohydrates, sugar, and seed oils. This is not a temporary diet. This is the permanent removal of the substances that cause the disease. Through diet and lifestyle changes, eating non-processed foods, non-refined products, the body begins to heal itself. The insulin demand drops. The sensitivity returns. The evidence for dietary reversal is robust. The Virta Health clinical trial, published in 2018 in Diabetes Therapy, enrolled 262 type 2 diabetic patients in a medically supervised low-carbohydrate dietary intervention. After 1 year, 60% of participants had reversed their diabetes, achieving A1C below 6.5 without diabetes medications, excluding metformin, or with reduced medication. The average A1C dropped from 7.6 to 6.3. The average weight loss was 12% of body weight. Insulin medication was eliminated or reduced in 94% of patients who were using it. The 2-year follow-up, published in 2019, showed that the improvements were sustained. 54% maintained reversal at 2 years. No drug trial has ever achieved comparable results. The intervention was food, not pharmaceuticals. The DiRECT trial, Diabetes Remission Clinical Trial, published in The Lancet in 2018 by Taylor and colleagues, took a different approach. Caloric restriction followed by food reintroduction. Participants followed a very low calorie formula diet, 800 calories per day, for 12 to 20 weeks, then gradually reintroduced real food. At 1 year, 46% of participants achieved diabetes remission, defined as A1C below 6.5 without any diabetes medication. Among those who lost 15 kilograms or more, the remission rate was 86%. The 2-year follow-up showed 36% maintained remission. The mechanism: the caloric restriction depleted liver fat and pancreatic fat, the ectopic fat deposits that drive insulin resistance and impair beta cell function. When the fat was removed, the liver regained insulin sensitivity, and the beta cells regained their ability to produce insulin in a controlled, proportionate manner. The pancreas was not permanently damaged. It was reversibly impaired by fat that could be removed through dietary intervention. Fasting, the second intervention, works through the same mechanism but with additional benefits. When you fast, whether intermittent fasting, 16 to 24 hours, or extended fasting, 48 to 72 hours under medical supervision, insulin levels drop to their baseline minimum. During the fasted state, your body transitions from glucose metabolism to fat metabolism, burning stored fat, including the ectopic fat in the liver and pancreas that drives insulin resistance. The liver depletes its glycogen stores, then shifts to gluconeogenesis and ketogenesis. Insulin levels, which are chronically elevated in insulin-resistant individuals even during overnight fasts, drop further and stay low throughout the fasting period. This sustained period of low insulin exposure allows insulin receptors to resensitize. The constant barrage of insulin signals ceases, and the receptors upregulate to respond to lower concentrations. Dr. Jason Fung, nephrologist and author of the Diabetes Code, has published case series and clinical observations documenting the reversal of type 2 diabetes through therapeutic fasting combined with dietary change. His protocol typically involves intermittent fasting, 24 to 36 hours, 2 to 3 times per week, combined with a real food carbohydrate diet on eating days. He has reported patients discontinuing insulin therapy within weeks. Under medical supervision, as fasting insulin levels normalize and glucose control improves. The key phrase is under medical supervision. Reducing diabetes medications during fasting must be done with medical guidance because medications dosed for a diabetic metabolism can produce dangerous hypoglycemia in a metabolism that is rapidly resensitizing. The reversal protocol, step by step, phase 1 medical baseline. Get comprehensive blood work, fasting glucose, fasting insulin, A1C, lipid panel, including triglycerides and HDL for ratio calculation, liver function tests, ALT and AST elevated levels suggest fatty liver, kidney function, creatinine, EGFR, microalbumin. This is your starting point. You cannot measure progress without a baseline. Phase 2, dietary transition. Over 2 to 4 weeks, transition from a standard processed diet to a real food diet. Eliminate sugar, processed carbohydrates, seed oils, and emulsifiers. Replace with vegetables, quality protein, healthy fats, and moderate amounts of legumes, nuts, and whole fruits. This gradual transition prevents the shock of abrupt carbohydrate withdrawal and allows blood sugar and medication adjustments to occur safely. Phase 3. Introduce time-restricted eating. Begin with a 12-hour eating window, dinner at 7 p.m., breakfast at 7 a.m. Over 2 weeks, compress to a 16-8 pattern, first meal at 11 a.m., last meal at 7 p.m. This extends the overnight fast, lowers fasting insulin, and begins the receptor resensitization process. Phase 4. Introduce longer fasts. Under medical supervision, particularly if on diabetes medications, introduce 24-hour fasts once or twice per week. Eat dinner, skip the next day's meals, eat dinner the following day. This produces 24 hours of sustained low insulin, accelerating receptor recovery. Phase 5, monitor and adjust medications. Recheck blood work at 4, 8, and 12 weeks. As fasting glucose and A1C improve, work with your doctor to reduce medications, starting with insulin and sulfonylureas, which carry the highest hypoglycemia risk during dietary improvement. The goal is medication elimination guided by improving lab values, not arbitrary drug discontinuation. The timeline for reversal varies. Patients with recent onset diabetes, less than 5 years, and preserve beta cell function often achieve reversal within 3 to 6 months. Patients with longer duration diabetes, 10 plus years, and significant beta cell loss may achieve partial reversal, reduced medication, improved A1C, restored metabolic health, without achieving complete medication elimination. The degree of reversal correlates with how much beta cell function remains. This is why early intervention matters. Reversing diabetes at the insulin resistance stage before beta cell burnout is dramatically more successful than reversing it after years of overt hyperglycemia. Let me close with the truth that should make you angry. Type 2 diabetes is called a chronic progressive disease, and for patients managed with the standard pharmaceutical escalation protocol, it behaves like one. More drugs, higher doses, worsening control, accumulating complications. But this trajectory is not inevitable. It is a product of the treatment strategy, a strategy that manages glucose without addressing insulin resistance, that adds medications without removing the dietary cause, that treats the smoke without extinguishing the fire. When the treatment strategy changes, when the root cause is addressed through dietary change and fasting, the disease doesn't progress, it reverses. Not in theory. In published clinical trials with hundreds of patients, the chronic progressive label is not a property of the disease, it is a property of how we treat it. Change the treatment, and you change the trajectory. The power to reverse this disease does not live in a pharmacy, it lives in your kitchen. In the next video, I'm going to expose the specific lab tests that your doctor relies on most, hemoglobin A1C, and show you exactly how it lies. A1C of 5.4 perfectly normal, while your fasting insulin is 22 and your disease has been building for years. The number your doctor trusts most is the number that misleads most. I'll show you why. I'll see you there.